There is an urgent need to take action to avoid people with epilepsy suffering from preventable death. That's according to a charity. The Epilepsy Society has called on the government to perform an audit of the care people with the condition are receiving. Well, let's cross live now. Dr. Matthew Sowemimo standing by now. He's actually from the Epilepsy Society. He's in our Westminster studio for us this morning. Doctor, thank you very much for joining us. Explain exactly the utility of a national audit of epilepsy care.
Well, epilepsy is a major cause of premature death in the United Kingdom, but we know that 39% of epilepsy-related deaths are actually avoidable. So what we need to do is to be able to get the facts in order to save lives. So Epilepsy Society is calling for a national clinical audit where we go through all of the medical records of people who've died of epilepsy and identify what are the major drivers of epilepsy-related death. So is it, for example, someone had a heart defect that has been undetected? And once we've got the facts, we will be able to direct effort and funding and resource in order to save lives.
In your mind, though, what is the reason behind it? 39% of epilepsy deaths deemed avoidable. That's a huge number. What is the problem with the care that is currently being provided?
Absolutely, as you say, it's a huge number, and what we know as the Epilepsy Society is a key factor is people not getting access to specialist care and not getting access to specialist care in a timely way. So, for example, people might not be seeing a consultant neurologist. If they're not seeing a neurologist, they're less likely to be able to get on the drugs that will be able to reduce and control their seizures and therefore cut their risk of premature death.
Part of the problem, isn't it, Doctor, that epilepsy is something of a dynamic condition, that those that are suffering from it might have to deal with a number of separate professionals over the course of their illness?
Yeah, absolutely, but it's really important that people are seeing specialist neurologists and also specialist nurses. So we know that 60% of trusts in England don't have an epilepsy specialist nurse. So despite all the professionals people might be seeing, if they've got access to an epilepsy specialist nurse, they're far more likely to be having the conversations about their risk level in relation to premature death. And the key thing is how they can reduce their risk of premature death.
Why that lack of specialist care, indeed complete absence of specialist care in certain parts of the country? Around about 500,000 people in the United Kingdom suffering from epilepsy.
Yeah, well, one of the problems is that the Department of Health 3 years ago took away the target for local health decision makers to monitor the proportion of epilepsy patients who are seizure-free, whose seizures are under control. Because a key risk in terms of premature death is whether or not people are still having seizures and whether their seizures are uncontrolled. So the lack of that information, not knowing how individual GPs are performing in relation to cutting seizures, means that we have less information about the people who are at risk. And for example, we don't know whether or not health services in Cornwall are performing less well than health services in Shrewsbury in terms of cutting people's risk of seizures and cutting people's risk of premature death.
Certainly plenty of information that this audit might reveal. Dr. Matthew Sowemimo from the Epilepsy Society, thank you very much for joining us on Sunrise this morning.
Thank you.